Hello, all, and thank you for joining us on In Time. We have it's wow. We decided we were going to come on to cover the COVID-19 updates, and while we were preparing for it, U.S.-led coalition strikes began occurring in eastern Syria against military targets in eastern Syria. This appears to be in retaliation for a Syrian militant group that has attacked a base in Iraq. The base fell under pretty significant rocket fire and killed 3 people. To the best of our knowledge at this point, it's 3 people. 2 of them were U.S. soldiers. So we will try to stay on that. My hope is, and my expectation is, that this isn't going to turn into what we had last month. It is the 22nd rocket attack since October occurring in Iraq. This was not a U.S. military base. This was actually an Iraqi military base that does house U.S. forces and civilians. The attack does again appear to have killed 3 people, 2 of them U.S. troops, and we retaliated against a militia, it appears, in Syria, and probably, since Syria is in fact an ally, probably with the consent of the Royal House of Saud. But we will keep an eye on that while we go to what our main story is at this point, covering updates in the COVID-19 pandemic. According to the World Health Organization, it has been upgraded today to a pandemic, and as of today, a number of things have happened. Italy has expanded its lockdown, closing everything except for emergency international travel and all but essential businesses like grocery stores and the like, and all but non-essential government services have been suspended. India has also now blocked all non-essential travel. In Chancellor Merkel has said that she anticipates between 60 and 70% of Germans will become infected with the COVID-19 virus. In the United States, 12 states have declared a state of emergency. In New York, Governor Andrew Cuomo has said that all state and city universities will switch to primarily online classes. In Massachusetts, a number of universities has done the same thing. Harvard University has switched to online classes, and the University of Amherst has requested students not return from spring break. That was legit what they said. Just don't come back to Massachusetts. The St. Patrick's Day Parade in Boston has been canceled. That's huge for Boston. That's absolutely huge. We have a huge Irish population in Boston. It's been canceled there. I believe it's been canceled in New York and in Washington. New York is the biggest in the country. The NCAA has banned all sports fans from March Madness. It will be essential personnel only. It's going to make for some empty bleachers. Governor Jay Inslee of Washington has closed public schools for 2 weeks and has put a ban on the Seattle area on parades, concerts, festivals, and other gatherings which exceed 250 people. That restriction is going to go at least through March and is expected to negatively affect the baseball season. And one other interesting side note, Kentucky has asked that churches cancel services, which for churches in the extraordinarily religious state of Kentucky is quite an ask. No word yet on how many are actually going to follow through with it, but that's pretty significant. So what we have here is a great deal going on. We have some more information than last time when we spoke about what is the transmission rates and the lethality rates of this disease. And I think Courtney, you had the $1,000 question about all this.
You want me to ask it, Nick?
Please. That was a good question.
Well, hello, in time people. My biggest question is, I think the one that we should all be kind of trying to keep in mind is the difference between all of these changes happening as a result of actual damage that the virus is doing or the panic that it is causing. So the public's perception of the danger versus the actual danger, and so I think that is the biggest question to be asking and to be keeping in mind as we move forward, because it's good to keep some perspective and to know the difference between oh, everybody's panicking, there must be something getting worse and worse, versus looking at the facts of what's actually happening and kind of keeping our ear to the ground for that primarily. So yes, it has an impact on us. The level of panic, the stock market issues and everything, we're seeing that already. So that's something that obviously still affects everybody, what people think is happening or what people think should be happening. And so it's just important to keep in mind that there is a difference there between public perception and panic and what we should actually be worrying about, and maintaining focus on that.
I completely agree. To that end, we decided we wanted to bring on an expert to discuss these matters. We couldn't find one, so we brought Dr. Cy Gart on instead. Dr. Gart, how are you?
Very well, and I think you characterized it very well.
Yeah, thank you very much for joining us.
I'm the only guy you could get. That's true. Everybody else is busy.
Everybody else is running and hiding under their beds. So if you could quickly just tell us a little bit about yourself and sort of your credentials in this sort of ancillary fields with this.
Yeah, well, I'm not a physician. I'll tell you what I'm not, actually. I'm not a physician or a infectious disease epidemiologist, but my degree is in biochemistry, and I've worked in something called molecular epidemiology for many years. Nothing to do with infectious disease, but having to do with cancer causation. And I've worked with a lot of epidemiologists. I even have an ex-wife who's an epidemiologist, so I know something about the field as an amateur. And interestingly enough, I also lived in Milan for 10 years, and so I have many contacts there now who I check in with now and then and hear about what's going on in northern Italy, and for the last week or more.
What are they saying about that in Italy? How's the mood over there?
Well, it's pretty grim. A lot of stores are empty. The real problem, which we will get to, which could become a problem here, is a very close to saturation of medical facilities. So if you're an old sick person and you're coming down and you just come down with the flu-like symptoms, it's not clear that you'll get a bed. At least you may get one today, but you may not get one tomorrow. So this is the thing that's of great concern, I think, when we talk about whether there's cause for concern or panic. I think the answer is there's both. There's a degree of panic that is not warranted. On the other hand, there is a degree of caution that very much is warranted. And that's what I've been telling people, for example, in my own church. We've been talking about, should we close and should we cancel this and cancel that? And I've been saying, yes, please do. and that's been true for local events and all kinds of things that are going on throughout the country. And we don't have a full list. It would be thousands of items that are being canceled, and I actually think that's a good thing. As
The
bad
March
as it
Madness
is.
the March Madness is one of the bigger ones in my view, because that is a highly commercial event, and that generates a
Right.
tremendous amount of revenue. And in general, especially the NCAA, unfortunately, as much as we like to think it's about the players and it's about people having the colleges, it's a huge source of revenue for the colleges. The colleges care most about the money. That's why they don't pay those players, despite how much they make from that. It's just it's much more revenue than they get from academics, and to be willing to cancel that strikes me as taking this very seriously. Although Trump has not been a reassuring force. So things in Italy are pretty grim. There is reports of, in the U.S., a massive shortage on I shouldn't say massive. Let me rephrase that. Let's be a little more. There is a shortage of some products. Toilet paper, though, we were at the grocery store today. Toilet paper gone. Toilet paper gone. So there is a run on some products, and people are hunkering down. There's also a number of businesses that are asking people to telecommute. I personally have some friends who have been asked to telecommute. My wife works for a biotech in Boston. It looks like they are going to be. Your cat may not. Your cat will not be on the payroll. Your cat, I don't care how many times you deliberately put that cat on the screen. Oh, she just does it on her own. She's been just so you know what I have to deal with. She's been sitting there going like, isn't there a policy if she appears on air that she's an employee and needs to? Oh God, you wouldn't believe what I
think she has to say some lines. Isn't that the rule?
Yeah. I think that's right. If she doesn't say anything, it's just
that's right.
No, she's got to start poking the cat now, trying to get it to meow.
I would like to say real quick. I don't know, Nick, if you want to finish your thought.
Well, as soon as I finish my thought, we're going to be right on. So if it's on something else, then we can dive right back into this. What were you going to say?
Well, I was just going to say, kind of that, just to our guest's point about not really being qualified on this specifically. I do think that there's a big difference between the way that somebody who has a general expertise in that field will be able to look at things and see things a little more clearly than the general public, and interpret things, because within the psychology field, my degree is in psychology, and so I have a basic understanding of when a study comes out, what that means and what to look for and what that is. So I just kind of wanted to mention that I feel like you probably have a better understanding of generally what might be happening or what might be said and what that means than I think the general public, which is a large part of why I would have wanted to hear from you today. So I just wanted to put that out there, that's kind of, I don't know if you agree with that or not.
Well, I don't know, but first, I don't know. Can you hear me? Because I may be frozen.
Yes, you may need to refresh again, though.
Okay, I'll try that. It looks like I'm.
But yes, so when news usually covers things like psychological experiments, at least for me, I'm able to see the difference that there usually is between the way it's portrayed and what the study actually says. And so that's more my point, is that I feel like you might have a little bit better understanding of how to take in the information and interpret it in a way that uses your expertise, even if it's not specifically to this. So that's
well, that may be true.
The U.S. has just declared that we are suspending all travel to Europe for the next 30 days. Literally just happened. So my apologies. Please continue. There's literally, I told you, as soon as we start, it just rolls in.
Yeah, that's quite a step too. There's going to be a lot of terrible repercussions, economic repercussions from this. But I would say, in light of what Courtney just said, which was very nice to hear, but the one thing that I think I can add a little bit to, perhaps, to the conversation is, and this is not just coming from me, you'll hear this from a lot of people, including journalists. What we have to think about in these days is not the way things are or the way things have been. We have to remember that old saw about, if I give you a penny today and I double it every day, how much money will you have at the end of the month? And the answer is billions and billions of dollars. And that's it. The idea of exponential growth is something that people are not familiar with. They're not able to think of, we tend to think of linear growth. So if something is worth, or if there's 5 things happening and it's growing, you'll get 10, and then eventually you get 15, and then you'll get 20. No, you get 5, 10, 100. It goes exponential growth of anything, and including diseases, is a critical and very dangerous thing because it creeps up on you immediately. Let me just give you a little data from Italy, which is now the world hotspot. China has calmed down a bit, which is good news, but Italy is not doing well. So on the 22nd of, well, let me start this way. On the 20th of February, they reported their first 3 cases. And a day later, they had 20 cases, from 3 to 20. And the next day, the 22nd, they had 63. And now there are basically over 10,000 cases and, I don't know, something like 500 or 600 deaths. Hard to keep track. That's exactly epidemic exponential growth. And that's what we have to be very careful to avoid, because if we get there, we're going to have a lot of trouble taking care of sick people. We may simply run out of beds, and that's almost happening in Italy now. And there's not much you can do at that point.
Do we know anything about the transmission rates and the incubation period, how long it's in somebody and they're asymptomatic, which is to say they don't show any symptoms, but they're contagious? Do we know anything about that?
We know a little, and I should have really prefaced all of this by saying there's much more that we don't know than we do know, and that's a real problem. But it looks like the incubation period is around 5 days, which is longer than most flus, which is about 2 days. And that's a real problem, because the longer the incubation period, the more likely and the more easy it is for it to spread without us realizing it. So the worst case scenario is you walk into a meeting or a gathering or a supermarket or a subway or whatever, and everybody seems fine. And you say, well, there's nothing to worry about. And then 3 days later, half the people you saw are sick. Now I don't mean to be overly alarmist. That's an extreme case. And there aren't many diseases that are that infectious and also lethal, which is a lucky thing. But when you have a disease that is infectious and has some degree of lethality, although this is still limited, it's too late to deal with it once it looks like it's really becoming a problem. It has to be dealt with beforehand, and that's why I'm very much in favor, based on the way this thing has spread in Italy and in some of the other countries. I'm totally in favor of doing anything we can that is, relatively easy and cheap to do. Now, canceling NCAA, as you said, Nick, that's not cheap. That's gonna have some dramatic economic effects. But not only, think of all the businesses, the restaurants, you name it, that are just, going to be in terrible shape when this is over. But the good news, after all that gloom and doom, the good news is that in some places like China now, to some degree South Korea, that's complicated, and definitely in Singapore, those kinds of measures have had positive effects. The spread of the disease has slowed. In China, it's like 10 new cases a day, which is almost nothing for them. And South Korea looked like it was doing very well. There's another small outbreak, I believe, as of yesterday. Singapore has done well, and I think Hong Kong as well have instituted these kinds of preventive measures that have been positive. And when we think about the China situation, remember although they were late, when they finally started acting, they imposed draconian measures on the population, which only China can do. We wouldn't and couldn't do that here. But they did that, and the results are being seen now. So I think that short of doing things like, military quarantines and things that we don't want to even think about, the idea of canceling, churches, canceling parades, canceling, working from home, sending college students home. Our son is going to be coming back from Harvard in a few days, and that semester's canceled. So the Harvard students are not going back either, and probably that's spreading now. I think I've heard of 4 or 5 other colleges, Rutgers, which is my own university where I have an appointment, and University of Maryland, near where I live. These are all doing the same thing. So that's very annoying, very aggravating. It will be costly, but it's the right thing to do. And I think that social distancing, whenever possible, is also the right thing to do. At this, not later, but now.
So just to quickly,
now it could turn
one of the points.
Sorry, go
ahead. Please finish your thought, and then I'll.
No, I was just going to say, there is still a chance that we'll find out that very few people actually got sick, little clusters here and there as they are now. And then everyone will say, oh, those alarmists, they were panicking for no reason. But, we don't know that. And it's, I would feel much happier being wrong about this than if I said something like, just forget about it, do whatever you want. And then lots of people got sick. That's a much worse scenario. And especially getting sick is not the worst part. The worst part is that this does have some degree of lethality, especially among certain populations. So,
well, and I think to speak to one of your points, I think this is the next thing I want to talk about. So, in communicable diseases like this, the worst diseases are the ones that evenly balance the rates of transmission with how lethal they are. So, for example, one that did a great balance, unfortunately, was bubonic plague. Has a very good balance. It can be very lethal, but not right away. Ebola is so lethal, it doesn't transmit very well because the incubation period there is about 24 hours. You can't get on a plane and not know by the time you land that you're profoundly ill. So it makes it very difficult for that disease to, as lethal and as scary as it is, it's not just the lethality that scares people, it's the transmission rates versus the lethality. So what we're talking about I
was going to say also the latent period is very important as well.
Yes. So this is obviously not as deadly as Ebola. And we had Ebola. So we had the Ebola scare a while back where there was an Ebola outbreak. People were worried it was going to come to the U.S. We even brought people to the U.S. to treat them. People were like, no, you can't do that. You can't bring it into the U.S. But we were able to really keep it. But here it is. It's this huge deadly disease. But because of the low incubation period and very, very high lethality, it actually doesn't kill a lot of people every year. The flu, on the other hand, kills more people because even though the lethality is less, the transmission rates are higher. Now, the transmission rates for this are, as I understand it, higher than for the flu. Higher transmission rates and higher lethality in general for the flu, but we'll get into those numbers in a second. So what is scaring people here about it? Is it the transmission rates? Is it the lethality numbers? What do you think is causing the
Well, I think what most of the professionals working on this are most upset and worried about is the lack of information. We don't really know any of those numbers, and we should know them. I could say something about Ebola because I was actually, in 2014, I was actually somewhat involved. I was working at the Uniformed Services University of the Health Sciences, which is the military medical school, and I was I was the vice president for research briefly, and I was working with some of the military people who actually went to Africa with the army to deal with the Ebola crisis. And what they did, and these are unsung heroes, there was so much noise in this country about what you said, Nick, about letting people in or not, that very few people realize that our military basically saved the day. It's a terrible disease. If they hadn't gone to Africa and gone into the field and vaccinated and went throughout the countryside looking for people and treating them and curing them, of course, exposing themselves as well, I don't know what would have happened. It might not have had such a great outcome. Ebola is a terrible disease. So, this is an example of when our military really stood up and just did what they had to do with very little recognition. So whenever possible, I like to tell that story so people understand it. Mm. That's not anything we can do now, of course, because we're way past containment. Ebola was contained where it started and eventually wiped out. We're way past that. We're at the pandemic where it's all over the world, and all we can do now is follow the successful models that have been done in some parts of the world, mostly in Asia, and take all those preventative measures to prevent the transmission. Now, when you asked the question, Nick, about how transmissible is it, it's a very complicated question because it has to do with a lot of different factors. How stable is the virus? Does it last outside the body? Does it move from surface to people? And all of these things are still being studied. It obviously does to some extent, and that's why hand washing is being pushed so strongly. But we don't know to what degree. And the latent period is roughly 5 days, but it could be variable, so we don't know that either. And the other issue I will bring up, which is a little bit grimmer than anything, is that when you have this many people infected around the world, it's a virus. Viruses mutate. So there's a lot of viruses out there, and we may end up seeing more than one disease. It could mutate into a milder form. That has happened in the past, or it could mutate into a more virulent form. But you're generally correct that virulence and transmissibility are often fighting each other. So that's why it's highly unlikely we'll ever see a virus or any kind of disease that kills everybody on the planet. That's probably not going to ever happen. There are some scary counterexamples, like the plague, as you mentioned, and even the 1918 flu was pretty bad. But what we're trying to do now, the Spanish flu, right? What the public health community is trying to do now is prevent a very specific thing, which is so many cases of seriously ill people. And we have a lot of older people in this country who are at risk, and a lot of people with other conditions. And if we start filling up intensive care unit beds, we're not sure what to do. We haven't had this kind of a epidemic, I don't know, since 1918. So we're not. We have a lot of beds. It's not an immediate danger, but as I said, it's people are worried about that now in Italy, and we want to avoid getting into that situation. So the more we can do now, the better. That's my view. It's just an opinion.
It strikes me as a pretty good opinion. I don't think many people contest that.
Okay.
So just to recap for people just joining us, the first thing we covered is that there was a rocket attack earlier today, about 2 hours ago, it looks like, in Iraq. It killed 3 people, at least first reports are, it killed 3 people, 2 U.S. soldiers and 1 soldier that I heard was UK, but I don't think the UK still has people in there even as advisors, so I don't, actually I think we do, so. But at any rate, the U.S. retaliated on a site, at least one site, possibly more, in eastern Syria, ostensibly with the foreknowledge of the Syrian government, and attacking a militia group which appears to be behind the attack. Donald Trump has announced that as of Friday, he is suspending travel to Europe, and in an effort to contain this. And we covered more than I care to cover again, from the NCAA to St. Patrick's Day to all sorts of other closures and quarantines across the United States, mostly on the coasts right now, which is where 12 states and the District of Columbia now has declared a state of emergency. And we are here with Cy Gart to cover all the cheery news that he has to offer with this. I love having him on because he's just always, well, I'm not saying that everybody on the planet's going to die. That's not likely. Thanks. Glad that's the low bar. So you had said we don't know. So I want to cover, I think there are 2 other big things to cover, and then that we may just have a lot of it. I'm sure Courtney's going to have a couple of questions, but the first is, so the 2 things I want to cover is what are the numbers we're getting? Because I'm looking at a lot of numbers and there's a lot of confusion. So I want to cover some of those numbers with you and see if there's any agreement or what we're talking about. And the second thing is I want to cover what the U.S. response has been. You had discussed some concerns, I think, about the NIH, if you're willing to talk about that a little bit here. I think Donald Trump has not demonstrated good organizational skills, and he has not demonstrated, to the best of my knowledge, any interest in listening to the advice of people who are experts on any given topic, and I am wondering if perhaps we're paying the price for that now. But let's start with the death rates. Do you know what the death rate for this is? Does anybody know? Do we know how many people it kills out of how many it infects?
No, we don't. And the reason is because we don't know the denominator. We really don't know how many people are infected, or how many people even have the COVID-19 disease. There could be hundreds of people who have the flu and are not getting tested. And so we don't know if they have the flu or they have COVID-19. And that's got to change. And I think it will change fairly rapidly. I believe that testing kits are on their way or eventually arriving. So since we don't know that, it's very hard to say what the mortality rate is. We do know what it is in China. We know what it is in some of the other countries where there is more knowledge available, and it's higher than the flu. It's, of course, almost entirely age dependent, where people over 60 have a much higher risk. I think I heard some statistic that if you're over 80, it's something like 8%, 4% or 8%, I don't remember, but it goes up with every year of your age. And that, I think, is very much correlated with underlying health conditions, which increase also with age. So
could you clarify
it's variable.
that you just said the over 80 is 8% of what?
The mortality rate, if you get this disease and you get sick, the mortality rate is pretty high. And I don't remember exactly what it is. And anyway, whatever I might have remembered is probably out of date now anyway. None of these,
I just
none
wanted
of the
to
numbers.
Clarify that for the audience.
It was something, it was something between 4 and 8% of people over 80 or 80 or over getting.
Also, in China,
getting the virus or dying from it? Or
no, dying. Mortality once you get it. In other words, if you're that
age.
That's
I just wanted to clarify.
Yeah.
Oh, I'm sorry. Yeah, that's what I meant.
Okay.
80% of the people who died in China were over 60 years old.
Exactly.
More than 75% had underlying diseases such as cardiovascular and diseases, diabetes, and cancer. Now, here's the interesting thing. So, the World Health Organization initially said that they estimated that the mortality rate for this was about 3.1%. 3.1% of all the people who get it die. That was their
That's
estimate.
high.
Now, again, uh, um, well, the flu is depending on, and I had some pushback for this because I at one point said that the flu was 4%. The flu was 4% when you say the flu, the problem is I was using an aggregate number, and the reason you have to use an aggregate number is because it changes dramatically from year to year depending on any number of
Right.
factors. The flu, in many cases, is below 1. In some cases, gets much, much, much higher. So I think if you look for the general term that's used by the World Health Organization, and actually has Jesus, I forget exactly what. I'll look it up again. At any rate, the World Health Organization had the mortality rate for this at 3%. However, in Wuhan, which is where it started, the mortality rate was 4.9%, much higher. And right now, most of the cases of deaths are still from China because that's where it started, and then it spread out from there. Now, here's a couple interesting things about why these figures can be so difficult to understand. In China, first of all, some of the numbers from China we don't necessarily trust either. So that makes us, as soon as you say the intelligence, or not the intelligence, but the information coming out of China, there are a couple of problems with that statement just right off the bat. If you don't have some objections to saying the information coming out of China, the information coming out of North Korea, the information coming out of Russia, information has to be used like in the broadest sense of it's information, fiction, who knows. At any rate, the mortality rate there was about 4.9%. Now, one of the things is in China, they don't have a culture of retirement in the same way that we do. Their government doesn't expect people to retire. You basically work until you work yourself to death. And so in Wuhan, there was a much higher proportion of elderly than there are in other provinces, and a lot of them were working. They were coming into contact with each other a great deal, and they were elderly. So you're going to get higher numbers there than what you might get otherwise. The number dropped to 2.1% nationwide across China. That's what it was as of February 3rd. Now that's actually quite some time ago, so the numbers are still obviously changing, but the problem is you end up with things that can skew these numbers left and right. So are there any numbers that you've heard, Cy, that you do think are appealing, that strike you as credible, and what would you expect to see if numbers are, what is a high number and what a low number for you, in your opinion?
Well, the answer to your first question is no. We don't have numbers simply because we don't know how many people are being infected, so we can't tell the mortality rate. But a low number would be between 1% and 2%, and especially that would be probably as happened in China in the older age group. A high number would be anything above 3, 4, or 5%, or around there. That's a lot of people. And if to say 3 or 4 sounds like a small number, but percent is out of 100. So if you're talking about 1,000 people, that's 40. If you're talking about 10,000 people, it's 400 deaths. Okay, and so on. And we have a large population. So 4% is a very, very high number of deaths.
Well, and Angela Merkel said she expects up to 70% of German. So 70%, she says between 60 and 70% of Germans she expects to be infected. If the mortality rate is 4%, that means 4% out of that 70 are expected to die. That's a huge percentage of the population.
So here's the thing. How many people getting infected is absolutely impossible to predict, because it will depend on measures that are taken. It'll depend on who happened to go where and touch whom, and things that cannot be told in advance. So, for example, in the Spanish flu epidemic, which is the last big pandemic we've had in the world, the infection rate and the mortality rate, which went along with the infection rate, depended, even in the United States, on what city you're in. There were some cities that just ignored it, and there were other cities that took some preventive measures early on, and the difference was dramatic. So, that's a lesson from history we should learn. So if there is some part of the country that decides, well, this is all a hoax, or this is just a silly panic thing, we're not going to worry about it, you will see a higher infection rate eventually there than you will in places where everyone is being cautioned to stay home and, social distance and et cetera. And we already see that with this one because, as I said before, we see it in places like Singapore, Hong Kong, South Korea to some extent, where the spread is nowhere near as it was in Italy. Now, in Italy, they took measures, but they took them late. They were too late. The thing had already started, and there's a certain degree of built-in chaos in the Italian response system anyway. I lived there for 10 years, so I know what I'm talking about. But anyway, they're doing the best they can now, but it's a little bit late. For people who just tuned in, this is why I'm at this point pretty much siding with the idea of, as painful as it seems to be, which is canceling the St. Patrick's Day parade, canceling NCAA. We don't want to face a situation that they're facing in Italy, where sick people who are on the verge of death simply have no room to be treated in a hospital because there's not enough beds. We don't want to get anywhere near that. And I'm not saying it's likely. I have no idea, but it's not impossible. And so it's worth doing what we can to avoid even the possibility of that. That's my view.
How do you think? Oh, please.
Sorry. There has been some things I've heard about the virus spreading faster than the flu, or being more contagious than the flu, but it not being nearly as fatal as the flu is. And you guys are kind of saying that it might be the opposite, but I think the biggest take home is that we don't really know yet.
We don't really know. You're right. That's it. That's true.
Yeah. So, but I guess it depends on where we're looking at, because I guess there are places in the world so far that it looks like it is more contagious than the flu, maybe.
Yeah, what's very odd about this one, and I'm not an infectious disease expert by any means, but I'm very sort of surprised by some of the patterns that we're seeing, which is we find outbreaks, for example, Westchester, New York, where there's an outbreak that's very contained in a small area, but in that area, it's gone wild. We see that in some nursing homes. We saw it on some of the cruise ships. So it looks like this is very infective in certain cases, but then it doesn't necessarily break out. And we're also seeing that in Asia. We're seeing that in South Korea. And again, I'll mention Singapore and Hong Kong again. We're seeing pockets of what looks like really bad community infection, but then it doesn't go further. So I don't know if that's real. It may not be. It may just be a fluke of the early days. It may not have anything to do with the disease. You would expect to see that kind of thing when it first starts, and then eventually it just spreads out. So we don't know yet what it's going to look like. So the fact, as I keep saying, the main thing we know is that there's too much we don't know. And so, what do you do in that circumstance? Well, we do know that when you're in this kind of position, the best thing to do is an overabundance of caution. Not an abundance, but an overabundance. Because, it's a pain in the neck, but it doesn't kill anybody.
And in keeping with that, the NBA has now announced, as of just a few moments ago, that they are suspending this season. So as the National Basketball Association, there will be no basketball this year.
Wow.
Whoa.
So
That's
Yeah,
big.
like I said, we start these shows, dude. It just keeps rolling.
It's all your fault, Nick. You're doing all this.
What?
It's you.
What?
Yeah, this is all
I
your fault.
don't shoot
No,
the messenger. Courtney,
all
tell
this
him, get
bad
him, get him,
news.
get him.
All this bad news starts with you. You do an in-time show, you get people on, and the world goes to hell. Just like
Oh
that. I
I
no.
mean,
think
Are we
I think
the
Courtney's going to
are we
explain
the
to you the difference
factor?
between correlation and causality at some point.
Yes, yes. We
yeah,
can
I've
we
heard
can
that
have
there's
that
some problem
discussion.
there. Very good.
Oh
So,
man.
and one of the things that we're doing on In Time to help, because we are taking this very seriously, is, oh, hold on one second. I gotta fix that problem. So I every now and then I develop static electricity. If I touch the corner of my monitor, poof, everything resets. But everything's okay. No, we are.
And that's when
We
it
agree.
becomes my show.
You and your cat, we
When
both
he
know.
goes,
That's what she's going
when
to be
he
the new
freezes, it
co-host,
becomes,
isn't it? That's what you're setting up.
yep. When you freeze, it's me
Okay,
and
now I
Luna.
get it.
Yep.
Great, I've been replaced by a cat. It's probably going to get
We'll
more
have
views.
to put,
But at any rate,
I'll have to send you a picture of Luna and we can put it in the intro.
oh God.
That'd be
Well,
great.
between that and Mikey stealing my seat, was stealing my office. So, and then what was it? Well, no, yeah, the NBA. We have in the live chat the NCAA was canceled, not the NBA. That's coming to us from Periscope. Nope, the NBA just canceled too. That's brand new. That's just breaking. A lot of news sources don't have that yet, but it's the NBA is suspended, has suspended this season. But oh shit, what were we talking about a second
Nick's
ago?
psychic power.
Yeah, well, oh yeah, no. So one of the things we're doing here on In Time to try to help with this is we're sending moderators. We're quarantining moderators, and we're planning on sending Mr. Designs to Italy, and he's that we'll have him quarantined. That is our thing. You've got no idea. That guy's the bane of my existence. At any rate, somebody modded him. I have no idea who, but I haven't been able to figure out the thing enough to just like demod X. I don't know. At any rate, he can be our reporter on the ground from Italy. We'll send him to all the hot spots, and he'll get us all the latest info. At any rate, yeah. So this is watch a live show to see what happens. Hopefully, there's no more rocket attacks. People thought I was kidding when I said that. There's somebody when I said there was a rocket attack again. They're like, "Wait, they're showing the promo from a month ago." No, I really wish, but no. All right, so basically, we have just for people joining us. There's been a lot going on, but I think the biggest takeaway here is that Dr. Gart doesn't know anything about any of this, and he's made that crystal clear repeatedly. Which we're so glad to have you
That's
on.
right. You're right.
The humility of the
I think
informed is very important.
I think my last question before we start to wrap this up is what has oh yeah, somebody said the National Hockey League. Well, I think a lot of sports events are. I think this is going to be profound. I think we're on the cusp of seeing some pretty profound things happening, which is why we covered it as breaking news. This is literally things are happening now, and we'll be covering this again, I'm sure, in the next couple of days. But at any rate, I wanted to know what your thoughts were on the U.S. reaction so far. Are you and how the NIH, World Health Organization, I shudder every time I say this, Trump administration have how they've been handling this. Are you cautiously optimistic? Are you terrified? Are you hiding under your bed? Are you dancing with rainbows? What's
Well, I'm very happy to see that Tony Fauci is heading up this effort to respond. When I worked at NIH, I met him a couple of times. He's a force of nature. He's an amazing guy, and he's been through this several times. Not quite this bad, but he had a huge impact on curtailing AIDS. The institute that he heads, which is called Allergy and Infectious Diseases, used to have AIDS in the title because it was sort of set up to deal with that. And he's great. And I think everyone's listening to him, which is good. And by that, I mean the administration. I'm not going to talk about our president because I prefer not to do that on air. It's hard for me to remain, what's the word? Casual.
Yeah, it's hard. It's hard to remain calm. It's hard to keep
calm. That's the word.
swearing. It's
but
hard
I will say that
aneurysm. It's hard for. I'm sorry. Sorry. I'm not triggered.
But
I'm not triggered.
I will say that I'm moderately impressed with Pence. He seems to be, and I don't know this any more than anyone else watching TV. He seems to be listening to the professionals, and he's clearly someone who's taking this seriously, which is important. So I think the administration may have. I'm talking about Vice President Pence, the guy who is sort of in charge of the whole thing. But I like the fact that when he's asked a question, he immediately turns to either Fauci or somebody from the CDC and lets them answer it, which is appropriate. So I'm happy about that. I think there was a delay in getting the testing kits and even the testing procedures working. That gets very technical. I know a little bit about that. There's no reason to get into it. But the problem is that it's probably solved, and hopefully we'll get a lot more testing done starting immediately, or even starting earlier, like Monday. There's more testing going on, and that's very, very, very important. So I'm cautiously optimistic at this point. I don't see the administration doing anything drastically terrible at this point, because first of all, that would be politically unwise, to say the least, and I don't think it's an election year. I remember vaguely that's the case, so I don't think anyone wants to have that kind of mud on their face. So I'm optimistic that the federal government will do what it should be doing, and mostly at this point, it's the CDC giving guidance to local health departments and local people, governors, what to do, and their guidance is good. I would probably go a little bit further at this point, but that's just me. But local governors are stepping up, and they're doing probably what they have to do, and whether it's a university president who has to decide whether to shut down for the semester, or a church pastor who has to decide, no more services, or whatever it is on the local level, this is what's going to really make the difference, more than what the federal government does.
Two questions in the live chat I want to hit real quickly. Somebody asked, why toilet paper? This is not a joke.
Yeah, nobody knows.
Toilet paper. Yeah, and I researched it for the show. I found 4 different doctors who have 4 different opinions. They're as useful as you are. They've said they've got no idea.
That's right.
The general consensus was but actually, this is Courtney's wheelhouse. Courtney's she's gonna be able to answer this as well. They basically said it was a psychological thing. People, when you're dealing with hygiene, that's the first thing that people tend to think about, and where this is a hygienics problem, that it's making people feel comfortable. So they're just buying toilet paper is vanishing across the United States, across the world. And again, at our local grocery store, I was there today, none, gone. They still had food. We're looking at like people being told to stay in their homes for 2 weeks, and they're like, okay, frozen pizza, toilet paper. I'll be good with the toilet paper.
Also, water.
There's a whole bunch.
I would be surprised if water isn't being stocked up on. Because water is like probably the most important thing.
Yeah, I was actually speaking. I was speaking with a bunch of friends, and they were all saying that maybe it was to sort of like if you can create one of those suits, the environmental suits, so just wrap yourself up in toilet paper, and then the coronavirus can't get in. And you don't have to mummified to pay at least.
Oh
I
my
don't know. It's
God.
like do-it-yourself kits. I don't know what's going on, but I did look into
Well,
it, and
I do have the answer to this one, Nick. I have the answer.
okay, okay,
Hmm.
I may be useless for medical stuff, but I understand the toilet paper problem.
okay.
Most Americans, at least most white Americans, are from Europe, right? I mean, they have
Uh,
European
yeah,
ancestors.
far enough down. Yeah, 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 yeah. The ancestors. Yeah.
I mean, and in many places, like on the coasts, they could be grandparents. I mean, they're 2 or 3 generations back, right? I
Mm.
Yeah,
don't
yeah,
know
yeah.
a single country in Europe where toilet paper is not considered a luxury. And that especially is Eastern Europe. I
That's
mean,
an
even
interesting.
today,
Yeah,
it's not always. I mean, toilet paper was always the scarce commodity when things got bad. So
that's
I
a.
think that's my theory that people remember what their grandparents told them. You know, oh, when I was your
That's
age, we were lucky if we found a newspaper.
that's what my grandparents tell me all the time. I was like, make sure if the world's going to hell, you've got toilet paper.
There you go. There you go. So that's my theory.
Oh
I'll publish
no.
it soon.
Well,
Write
and
a paper. Let us
um,
know.
I'm writing a
I do
paper.
have
Right.
kind of a point to bring up real quick. I know I'd like to wrap up too. I've got some work to get done, but just real quick, uh, there is a difference as with scientific research that comes out. There's a difference when things like this happen between the advice of the CDC, the best evidence that we have, and the way that it might be portrayed in the media.
Right.
And so I don't know if anybody between the three of us, I don't watch TV, regular TV. I don't watch TV news, especially. So I don't know if this has been covered accurately across the board or if there's good advice or good updates from the CDC. So at least for the audience, I would suggest going to the CDC website and kind of going to the source of what is being advised. But I wonder if you guys know if it's particularly like panicked. It seems like it is because everybody's talking about it. I work with children between the age of 7 and 17, and a lot of them
Hmm.
have said something about the coronavirus in the last couple weeks. There was
Sure.
kids coughing in class, and they're like, "Oh, they must have the coronavirus. Don't come near them." And it's
Right.
just like, panic. So I'm just curious if you guys have noticed if there's a difference between the news coverage and what's actually coming out of the CDC in terms of what to do and how to protect yourself.
Yeah, that's a very good question. I don't know. There are, well, fewer now. When this thing first broke in China, there was some really crazy stories that were circulating, and those have gone away, luckily. Things about weaponized and all this nonsense,
Mm.
uh, and they've gone away from most of the media. So I think you're right. I think there are some. I mean, journalists are humans too, and if you get a nice juicy story that is panic inducing, that does well. Okay, so there's maybe some of that, and I don't know whether that has. It probably would have an influence on people, but at this point, my own view, just looking at what we do know, and we know a little bit. I mean, we know about the numbers of cases in various states. We know a lot about the spread. And that's enough for me to think that it's not a bad thing if people take it more seriously, even if they maybe panic a little bit, and that panic drives them to, really wash their hands and stay home and whenever they can, telework for work, do all these things that people are doing. Again, if it's an overreaction, so what? It's not hurting anybody.
Yeah.
If and
Yeah.
we'll all laugh at if that's the case, we'll laugh at ourselves and life will go back to normal. But that's better
Mm.
than an underreaction, which results in northern Italy kind of situation. We don't want that.
Yeah.
But you're raising
All
a
right.
good point. I mean, we have to trust somebody, and I think the CDC at this point is the best option among what we have.
It ain't gonna be you.
No, it's not me. Absolutely. Don't listen to anything I say.
Well, thanks for making that clear. I sit there, I put my reputation on the line. I sit there and say, we've got an expert in this thing. And first thing you can do is sit there and say, I don't know what I'm talking about, and then reiterate that every 7 minutes. Thanks. Oh, well, thank you all for joining us.
I love you too, Nick. You're a great guy.
You were absolutely my first choice after the other 7 canceled. This was... Thank you all for joining us. I do want to say this was Courtney's first breaking news, and I think she did a spectacular job. These shows are a little different; they're a little more intense, and we just go, and there's always something going on. But thank you. I think Courtney did a spectacular job. Cy, genuinely, thank you very much for coming, especially on short notice. You and I have been talking about it, but you've been following it, and I appreciated it because I think you actually really did lend clarity, even if it was to tell me that most of the time when I've been speculating on the numbers, maybe I don't know them as well as I think I do either. So that's good. I appreciate you coming down and giving us the skinny on this. We will be Courtney will actually, I think, be on Stitch tomorrow night. So she will be. Don't get out of your chair. That's all I have to say in the matter. Yeah,
you
he's
might
going to take a
screenshot
photo.
my cats at some point.
Yeah, well, and then he's going to put those
I've
in.
got a different one here now.
He's going to screenshot the cat in my chair is what's going to be next. I shouldn't be giving him ideas. So, Cy,
we had all
we
three
have a
of
new
them
show.
in the stream tonight.
Oh, God.
All three of them.
So, Cy, I don't know if you know, we have a new show, Stitch in Time. It's a wrap-up show, covers other things. And the guy we have running it, whose name shall not be named, he screenshotted when I got up out of my seat the green screen behind him, and now he's broadcasting from my office. People are sitting there going, and then when I'm on the show, both of us are sitting in my office. You explain that to me. But thank you all for joining us. What we're going to do is, Courtney should be on Stitch tomorrow. We will have Cirrus, the deconversion of Cirrus the Skeptic next week. If you, we're gonna keep covering this because this is still breaking news. We're not gonna do breaking news every time something changes. You got a television. There's gonna be probably Major League Baseball is gonna go out the door. Well, maybe not. Yeah, the season's coming up. They may go out the door. We're not gonna do breaking news for that. If we do it, it's because there's something significant or there's enough of a collection of serious stuff that's worth covering. We don't want to just ding your inbox, but if you want to make sure you get the breaking news, please subscribe, like. Also, you can become a Patreon. We talk to our patrons regularly. We have a regular Patreon hangout. One's coming up, and we're gonna we're completely Patreon supported, or viewer supported. So I hope you guys will consider that. But in the meantime, once again, thank you all for joining us. And for those of you who are catching up at the end, since this broadcast started, the NBA has canceled its season. The NCAA, now somebody suggested it's canceled. I don't think it's canceled. Last I heard, it was just March Madness is not canceled, but they're not going to have any fans there. 12 states plus DC is in a state of emergency. We have just see the recap at the top. It's a lot's going on, but thank you all for joining us, and we look forward to seeing you for more regularly scheduled programs. Hopefully things aren't going to get too cray-cray, but if they do, we will be here. And thank you all for joining us.
Bye-bye.